Hello, my name is Myah Cordrey. I'm currently a senior honor student at Marymount University, where I major in nursing. The research I completed a systematic literature review of the anti-vaccine movement and childhood vaccinations. So some background information on the topic. When examining vaccination rates of children ages 19 to 35 months in the United States, the percentage of unvaccinated children has risen from 0.3% to 1.3% from the year 2000 to 2017. Even though 1.3% may appear to be a small number of children, it's a 333% increase in unvaccinated children over the past 17 years. This increase has resulted in a number of outbreaks of infectious diseases across the United States, particularly measles. Some examples of vaccinations which have eradicated diseases in the U.S. include diphtheria and rubella. The measles vaccination was also successful at eradicating the disease from the U.S., but due to a recent decline in the number of vaccinations, cases have begun to increase in the U.S. Herd immunity, or community immunity, as it is sometimes referred to, is when enough of the population has immunity to an infectious disease to cause the spread of the infectious disease to other people to be unlikely. Herd immunity can develop through vaccination or from having the illness before. Herd immunity creates protection of those individuals who are unable to be vaccinated, like newborns and people with chronic illnesses, because there's a small chance of the illness spreading throughout the community. It is crucial that all vaccination rates remain high enough to create herd immunity and prevent outbreaks. As we all know, the world is experiencing the global pandemic of COVID-19. COVID-19 can cause many different side effects for individuals, with some of these side effects being long-term. COVID-19 can affect organs such as your heart, lungs, and brain. It has additionally been seen that it can cause blood clots. COVID-19 has resulted in hundreds of thousands of deaths in the United States. The development of the COVID-19 vaccine can potentially decrease the number of positive cases, thus decreasing the number of deaths that occur as a result of COVID-19. Receiving the vaccination is a safer method to building herd immunity against COVID-19 when compared to acquiring the virus. We are currently seeing a decrease in COVID cases and hospitalizations, which can most likely be attributed to the COVID-19 vaccine becoming available and herd immunity increasing. So the purpose of my systematic literature review is to analyze the impact of the declining vaccination rates in the United States, to determine the reasons as to why some parents do not vaccinate their children, identify who makes up the anti-vaccine movement, and the influence of social media on the ability of the anti-vaccine movement to spread their ideas. So when conducting my systematic literature review, it was conducted and reported according to the preferred reporting items for systematic reviews and meta-analyses, or the PRISMA guidelines. It was limited to articles that were English, peer-reviewed, and published between 2015 to 2020. Additionally, articles which contained studies completed outside the United States, adult vaccines, and vaccines not part of the Center for Disease Control and Prevention's vaccine schedule were excluded within the systematic literature review. The key words used were vaccinations in the United States, anti-vaccine movement, social media in the anti-vaccine movement, anti-vaccine beliefs, parental concerns with vaccines, and decline in vaccinations. The online databases which were used to find articles include Nursing and Allied Health, CINAHL, and PubMed. Websites from government sources such as the Center for Disease Control and Prevention and the United States Food and Drug Administration were also included, since these sources provide licensure for vaccinations. The article published by Andrew Wakefield was published before 2015, but it was pivotal in the anti-vaccination movement, even though it lacks scientific merit. It's a monumental article which began a movement against the measles, mumps, and rubella, or MMR vaccine, in which the anti-vaccine movement supported. Since his article forms the foundation of the anti-vaccine movement's argument that the MMR vaccine causes autism, it's necessary to include to explain reasons as to why some parents do not vaccinate their children. Also, you can see how I narrowed my search and my articles I found down to 17 articles in my Figure 1 literature search matrix. I began with 1,263 articles in my initial database search, and then through ref chasing or bibliographic review, I found an additional 269 articles. which in total makes 1,532 articles, in which I which I read the abstracts, and then 984 of those were excluded because they did not reach the search parameters, and an additional 503 articles were excluded because they were duplicate articles. And then from there, I had 45 full-text articles that were assessed for eligibility. Using the grade scale, I was able to chart these articles, and then 28 of them were excluded because the studies did not occur in the United States or did not provide relevant information to the purpose of this research, which then this left me with a total of 17 articles to use in my project. So my project resulted in finding out that most of the individuals who make up the anti-vaccine movement are women over the age of 40 and have higher educational levels, and they usually come from high incomes, usually around over $200,000 or more per year. There's also a higher presence of anti-vaccination ideas in geographic areas in the United States with larger populations and higher numbers of women who have recently given birth. Additionally, anti-vaccination or unvaccinated children tend to cluster in areas or in states which allow for exemptions for school-required vaccinations. Additionally, from my research, I also found that the 5 most common misconceptions surrounding vaccinations are the following: that vaccinations can overwhelm the immune system, they can cause autism, they can contain harmful ingredients, and that the natural disease provides more effective immune response. Additionally, another misconception is that the diseases that vaccines prevent are not present in the United States anymore. And that these misconceptions are supported by the anti-vaccine movement, and they primarily use social media as their tool of spreading and connecting with parents to teach them and tell them more about anti-vaccine beliefs. And then, so for my discussion, the outcomes of the 17 articles in government websites were all generally positive. The outcomes primarily evaluated parental concerns regarding vaccinations, how to combat parental concerns, anti-vaccine movement beliefs, and the role social media plays in delivering the anti-vaccine movement beliefs. The aims of the systematic literature review was to search, extract, and synthesize research completed in the last 5 years to report on the current state of the anti-vaccine movement's influence on childhood vaccinations, and how social media contributes to vaccination rates. So from my research, I found that it is essential to establish who makes up the anti-vaccination movement, the beliefs about childhood vaccinations held by some parents, and the impact social media has on spreading anti-vaccination beliefs in order to determine why there has been a decline in childhood vaccination rates over the past 2 decades. When trying to determine who composes the anti-vaccination movement and what the demographics of the people a part of the anti-vaccination movement are, there is limited information available. Due to the creation of social media and geographic tags, which are connected to social media posts, more information on the people supporting the anti-vaccination movement can be discovered. I also found there's the 5 main claims about vaccines that some parents believe and the anti-vaccine movement supports. After analyzing the claims of the anti-vaccine movement, the research does not support their claims except for the idea that vaccines provide a weaker immune response. Vaccines do provide a weaker immune response, which results in individuals having to receive booster shots in order to provide an effective immune response. By receiving booster shots, individuals protect themselves from experiencing the side effects of some of the vaccine-preventable diseases. In addition to knowing who makes up the anti-vaccine movement and some of their main claims, it's also important to look at the role of social media in spreading their claims to a wider audience, as well as gaining new members to their movement. There is an increased presence of the anti-vaccine ideas on social media platforms, especially on YouTube and Pinterest when compared to pro-vaccination ideas. Additionally, this review indicated that there gaps exist among comparable research designs in determining the geographically and socioeconomic characteristics of people in the anti-vaccine movement. Similar research designs do not define the characteristics of people who identify as being part of the anti-vaccine movement. Higher levels of evaluation and analysis need to be completed on the characteristics of the anti-vaccine movement and the use of social media and celebrities to spread the anti-vaccine movement's ideas, which will assist in furthering the understanding of how the anti-vaccine movement can influence parental decision-making regarding childhood vaccination. Since the number of children who are unvaccinated have continued to increase in the United States, it's imperative to find an effective educational measure for parents. One educational measure that's currently being developed by Johns Hopkins University is the Moms Talk Shots app. Moms Talk Shots is an interactive app that can be used on computers, tablets, and smartphones. When parents first download the app, it prompts them to fill out a survey to determine their knowledge, attitude, and beliefs about maternal and childhood vaccinations. Based off of the responses of the parents to the survey, the app has an algorithm that provides the parents with educational videos. Parents can also get additional education about vaccinations through the app, where they can also find other videos and written information about childhood vaccinations. The Mom Talk Shots app is not only for parents, but can also be used by providers as well. Through the research conducted in the systematic literature review, it's apparent that parents are using social media and applications to find out information on vaccinations, so the use of an app to ensure parents that they are receiving accurate information will be effective. The Mom Talk Shots app has the potential to be an effective educational measure to decrease vaccine hesitancy among parents and decrease the influence of the anti-vaccine movement. If the app is accepted by a majority of parents, it has the potential to decrease the effectiveness of the anti-vaccine movement, which would cause the childhood vaccination rates to increase in the United States. Further research needs to be conducted on methods that could be used to influence the ideas on vaccinations of people who identify as being part of the anti-vaccine movement. The findings of the systematic literature review can also provide information for nurses on the topic of the impact of the declining vaccination rate in the United States, and some reasons as to why some parents do not vaccinate their children, who makes up the anti-vaccine movement, and the influence of social media on the ability of the anti-vaccine movement to spread their ideas. Knowledge of these topics can provide nurses with information as to why some parents may decline their child receiving any or all vaccinations. It is also helpful for nurses to have knowledge of where the individuals of the anti-vaccine movement tend to cluster geographically and determine if they work within one of those clusters. Nurses are the individuals who provide education to parents about childhood vaccines. Nurses are also the #1 trusted profession for the past 18 years. Therefore, they have the unique opportunity to combat the common arguments made by the anti-vaccine movement through parental vaccine education. Nurses can also influence the vaccination rate of the COVID-19 vaccine. Now that the COVID-19 vaccine has been created and people have started to receive it, nurses can provide education and answer people's questions about the vaccine. A key part of educating others is making sure the nurse is educated on the vaccine. Through answering people's questions, hopefully the number of people who get the COVID-19 vaccine increases to the point where herd immunity is met. So in conclusion, when beginning the systematic literature review in the fall of 2019, it was impossible to predict that vaccines would become such a relevant topic in regards to the pandemic of COVID-19. The systematic literature review focused on analyzing the impact of the declining vaccination rates in the United States, determining the reasons as to why some parents do not vaccinate their children, identify who makes up the anti-vaccine movement, and the influence of social media on the ability of the anti-vaccine movement to spread their ideas. Even though the focus of the study was not specifically on the COVID-19 vaccine, the research findings of the systematic literature review can be applied to the COVID-19 vaccine to help decrease the fear, uncertainty, and hesitancy surrounding the COVID-19 vaccine.